I am Dr. Anil Menon, Professor of Endocrinology, and with me I have Dr. Milind Patil, Assistant Professor, Department of Endocrinology at Dr. D.Y. Patil Medical College, Hospital and Research Center. World Thyroid Day is observed every year on 25th May. The purpose of it is to raise the awareness about about the public about the prevention, diagnosis, and treatment of thyroid disorders. Thyroid disorders occur very commonly in the population. Up to 2% of the general population can be affected by thyroid disorders. And today we'll be discussing an important topic, that is how does thyroid gland or lesser functioning of thyroid gland affect pregnant ladies. So Dr. Milind, I would like to start by asking you, what is the role and function of thyroid gland in the human body?
Thyroid is basically a glandular structure which is located in the anterior part of the neck, and it produces mainly two hormones. The name of those hormones are T3 and T4. These hormones are basically needed for each and every function of the body. The main role is in energy homeostasis and the energy metabolism. And for the normal reproductive function, it is essential to have normal thyroid function in the patient.
Yeah, so actually, one should know that thyroid is an important part of the reproductive function both in males and females, that is men and women. And any disorder of thyroid, which can be either hyperfunctioning of thyroid gland or hypofunctioning of thyroid gland, can lead to issues with fertility. For example, ladies can have menstrual irregularities, infertility, miscarriages, preterm labor, and even the baby can have complications related to the development of brain. In the men, it can also lead to a low sperm count and decreased fertility. So, with this in background, I would like to know from you, Dr. Milu, that if a lady who's having known hypothyroidism and is on treatment and she wants to plan pregnancy, what would your advice be to her?
So the first advice will be take the treatment regularly, optimize your dosages, and keep the thyroid in the normal range. So the normal range of TSH is very wide, but for the pregnant lady, we take the TSH between 0.5 to 2.5, and patient has to keep their TSH in that range for better outcome.
So basically, when a lady is planning pregnancy, she should get her thyroid function checked. If it is less than 2.5, then it's a good limit to have and she can plan pregnancy.
Yeah. So now my question is, what advice you are going to give to this lady when she comes with a UPT test positive, that is, she has confirmed her pregnancy is positive? What will be your advice?
Yeah, so one should realize that the fetus is unable to produce thyroid for the first 12 weeks and actually is dependent on the mother's thyroid hormone. So, because of this increased demand that the pregnant lady has because of a fetus, she should increase the dose of thyroxine, whatever she's taking, by about 25 to 30% before consulting a doctor. So, as soon as the urine pregnancy test comes positive, it is advisable that she increases the dose by about 25 to 30% and then consults a doctor who would guide her further. Related to that, my question is, what would be the advice that once a lady conceives and is pregnant and is taking thyroxine or thyroid hormone, what would your advice be in general during the course of pregnancy?
So, few things I generally advise to the patient. That is, first thing is what we are doing in hypothyroidism is we are replacing the deficient amount of the thyroid hormone from outside. So, for better absorption, we have to follow certain rules. That tablet has to be taken on empty stomach. Then patient should not eat anything for at least 45 minutes. And specifically in the pregnancy, most of the pregnant women are on iron calcium supplementation. So these drugs can interfere with the absorption of thyroid medicine. So routine advice is they should not take these tablets within 2 to 4 hours after taking thyroxine medicine. That is the first thing. Second advice is during pregnancy the dose requirement is quite high. So some patients get afraid with a number like 100 or 25. So my advice is not to look at the number because we are replacing the deficient amount of hormone, and since we are giving the same hormone which is produced from the body, so there is nothing to get worried about the adverse effect of the tablet unless it's supervised. So advice will be take the tablet on regular basis, empty stomach, keep the gap between the tablet and food, keep the gap between thyroid tablet and other tablets, and periodic follow, maybe 4 to 6 weeks. Do your TSH and consult your doctor. This will be the routine advice.
Correct. So that's what you should do. Now, suppose she has a safe delivery and the baby is born healthy. What's further? Does she continue on the same dose?
No, the dose requirement goes down, and in most of the cases, patient can go back to the pre-pregnancy dose, and they should recheck the thyroid function test after 4 to 6 weeks of the delivery. Another important point here is patients are worried about whether mother is having hypothyroidism, then whether the baby will have thyroid problems. So the problem which can occur at the birth is called congenital hypothyroidism, and as per the guidelines, irrespective of mother's thyroid status, each and every newborn should be screened for the congenital hypothyroidism because it's a preventable and treatable cause of mental retardation. And timely starting the treatment can help the patient baby to develop normally.
That's correct. Actually, that's a very important thing that all newborns should be screened for hypothyroidism. It's a universal guidelines which everyone has to.
Yeah. So now we are coming for the guidelines. So there are guidelines for congenital hypothyroidism screening. So I would like to know from you whether we should screen all the pregnant ladies for thyroid dysfunction.
Yeah, that's a good question because it's always in the mind of the ladies that do they have a thyroid problem or during pregnancy should they get their thyroid function test. Now we generally have government guidelines, Government of India guidelines of 2014, which state that not all pregnant women need to be tested for thyroid. That testing should only be done in what we call as high risk. So which are these ladies who are at high risk of developing thyroid disorder? Those who have had some thyroid issues in the past, they are the ones who have undergone a surgery, for example, on the thyroid. So those who have a neck swelling, what we call as goiter, so these are the ladies, or who have had a bad history of previous births. For example, if they have had repeated miscarriages, early or preterm labor, or they have had issues with problem with fertility. These are the patients in whom we should test for thyroid function. Then there are some patients who are on drugs like lithium, amiodarone, which interfere with the thyroid synthesis. So these are the patients who should be screened while they conceive or before they conceive for thyroid disorders. So that's a very important thing. So I think that's enough for today. The education that we gave about hypothyroidism and its effect on pregnancy and what all needs to be done if you are a patient of hypothyroidism, and who are the patients whom you should screen for, and what is the importance of screening a baby or a newborn. Thank you very much.